If you find that you're getting a stuffy nose or ringing in the ears, or your throat's getting really scratchy and you don't know why. So your ears, nose and throat, they're all closely connected to each other. And during the perimenopause and menopause, hormonal changes and other issues can affect all of these areas. So what I'm going to do is talk about the common symptoms today and what you can do to help yourself. So if you think about it, if you get a cold, very often your nose is blocked, you get sore ears, and if you get a sore throat, you very often have ear pain. So the sort of channels between all of these are open, and when one's affected, the other can be affected as well. So the common problems would be your sinus problems. So it's sinus pain. It tends to be sort of here, maybe at the top of the nose and across the top of the head. So you may find you're getting chronic congestion of the sinuses that just won't clear. You might find you're getting nasal congestion. You're getting a lot of pressure, pain, and reduced smell as well. If all this is infected, very often it can affect your sense of smell. You may find you're getting a really dry throat. Your voice gets a bit scratchy. You find that your voice breaks. You might find that your vocal cords are being affected, and especially for those of you that sing, you may find that you're not hitting some of those notes. You just can't actually get there. You may find that your hearing's changing. You might find you're getting ringing in the ears either all the time or it comes and goes. You may find you have temporary loss of hearing. It's all of a sudden you've got a blocked ear. You may find that you're becoming increasingly sensitive to sounds as well. It may be increased infections generally. So your ear, your nose and your throat, you're getting more infections, more sore throats, maybe earache, you're getting more sinus problems. So you're getting them more often and more frequently too. It could be altered mucus production. So you may find your mucus is a lot thicker. It's gathering at the back of your throat and you can't shift it. It may be something called postnasal drip, which just means you can continually feel the sort of drip of mucus at the back of your throat. You may find it can be dryness. Your nose can get a lot drier and a lot more irritated. So what are the main causes? So we know that estrogen helps to maintain the moisture and elasticity of mucous membranes, and that can be anywhere in the body. So it's not just the vagina that can be affected here. It can be the ears, it can be the nose, and it can be the throat as well. So all of the mucus production here can decrease, which is going to mean that these mucous membranes are going to get drier. They're going to get inflamed more easily. They're going to be irritated and infected much more easily as well. And that means you can be much more vulnerable to sinus problems, colds, flu, and other ear, nose and throat infections. Progesterone as well has a slight influence on mucous membranes. It helps to retain the fluid balance and mucus production in the sinuses and the ears. You may find too that your immune function is affected, which makes you much more vulnerable to all sorts of other infections, not just because if you think about it, the throat is the one area which is mostly affected by viruses and bacteria that come along that cause all these particular problems. So, and the other factors could be just age in general. Unfortunately, the older you get, the more likely you are to get these particular issues. So as well as falling estrogen, it can be poor sleep, it can be fatigue, it can be stress, because all of these can impact on immune function as well. So sometimes it can be a combination of all these sort of sinus, ear, nose and throat issues and lowered immunity as well, making you much more vulnerable to absolutely everything. So what can you do to help yourself here? Number one, water. Keep yourself hydrated. Remember, these are mucous membranes and they depend on you being hydrated enough for them to maintain their mucosity, if you like. Try a humidifier. Maybe if you find, especially during the winter time, if you've got central heating on or the windows are shut, the air can get very, very dry, and that can affect you as well. So a humidifier can sometimes be a really good idea. You can get nasal sprays, and these can help to maintain and support the mucous membranes in the nasal passages. We have two. We have this one here, which is our nasal spray, Sinoforce, and we also have this one free, which is polinisan allergy nasal spray. So either of those can be used. You might find you want to look at herbs. So there is a herb called Plantago, and Plantago is a really good one for the ear, nose and throat. So it's anti-inflammatory, it's antibacterial, and it actually helps to control mucus production. So if you're not producing enough, it can help to produce more. And if you're producing too much, especially things like postnasal drip, then it can help to ease those symptoms. And Plantago is also really good for decreasing blocked ears and also sinuses. So it's a lovely all-round ear, nose and throat herb. Reduce irritating foods. So believe it or not, things like caffeine, spicy foods, alcohol, high salt and sugar foods, these can all impact on sinus problems, and especially dairy. Dairy is known to be mucus forming. So if you're having any kind of mucus issues, then cutting out dairy products for maybe a month or two can often speed up the whole healing process. Limit your exposure to things that can irritate you too. So this would be things like perfumes. A really bad one that a lot of people don't realize is these sprays and fragrances that you have in your home. Some of them are absolutely chock-a-block full of chemicals. And if you're breathing these in all the time, they're going to irritate all of these areas just basically continually. So be really careful. If you want to use nice scents in the home, then make sure that you go for completely natural ones. I would recommend these little ones that you can get, either battery operated ones or candle operated ones, where you put just pure essential oils in them. These are going to be much better for you generally. Look too at other things. If you find that you've got these symptoms, they've come on quite suddenly, believe it or not. So if you're, all these areas are more sensitive, if you get new carpet, new furniture, new bedding, you've redecorated your house, all of these, especially when everything is new, can release a whole raft of chemicals that can start to irritate these sensitive areas as well. So just sort of bear that in mind. Even washing powder, if you change your washing powder and suddenly find that you're getting a lot more irritated, it could be something as simple as that. So, you know, look outside of just what's happening to you to see if it could be an external irritant going on here. Eat anti-inflammatory foods. So that's things like your omega-3, that's your oily fish. If you're vegetarian or vegan, go for flaxseed oil, loads of antioxidant rich foods. So that's your fruit and your vegetables as well. Get regular checkups. It's so important as you get to the perimenopause and menopause. Get regular eye checks, because estrogen can affect the eyesight. Get your ears tested, especially if you start to get ear problems like tinnitus, or your hearing tends to come and go. And if you're in the UK, then the likes of Boots and Specsavers as well, they do free hearing tests. So it's well worth it just to rule things out if you're having these little issues. When do you contact the doctor? So if you're having any of these problems, you've tried all these self-help tips, you've checked that nothing in your environment is causing a problem, then just get everything checked out by your doctor just to make sure there's nothing else going on in the background. Hope you found this one helpful. It seems to be becoming more not more popular, but it seems to be becoming much more common. I'm getting more queries about this, especially during the winter months. So if you have any issues like this, what did you do to help yourself? Do you have any tips? Was there something you used that really worked well? Please share. You know, I love to read all your stories. Have a lovely week, and I'll see you soon.